Okay, Senator, everybody's in the room.
Okay. Hello, everybody. Is everybody in the room now? I think we're ready to go. If everybody's ready to go. Everybody ready? Okay. First of all, I'd like to thank the District 16 Democratic Club for allowing us to have this town hall today, and particularly your leadership, Elliot Greenwald. Particularly, thank you, Michael Tardif, for getting this all together. We couldn't have done it without you and your fabulous team. I just wanted to tell you, we began our 2022 session under the cloud of COVID-19 Omicron variant. The General Assembly, of course, for the very first time in many years, had a historic budget surplus that allowed us to make some transformative and generational investments for Maryland's future. And we were just absolutely excited about that because, in the past, we haven't had that money. And now we had a surplus so we could fund certain programs. But I'm really, really proud to serve with my District 16 colleagues. Delegate Ariana Kelly was just appointed as Vice Chair of the House Health and Government Operations Committee, and she led efforts to pass bills to provide greater access to abortion and reproductive health care and the family and medical leave, which was significant, the Time to Care Act. And Delegate Mark Corman, who is the chairman of our Montgomery County House delegation, passed some really great bills to expand things like mass transit infrastructure. And he led the way to pass tax credits for retirees and families and funding for important capital funding for those projects we really need, renovations and upgrades. And Delegate Sarah Love, who has been a real leader in environmental protection and clean environment and everything. And then she passed a very important bill this year dealing with PFAS. She'll tell you what that is, okay? And also she'll tell you about the bill that the Senate and the House passed, the Climate Change Solutions Act of 2022. That was presided over by her committee, and she was able to get it out. And we were able to, when she got over to the Senate side, we were able to pass it too. They'll provide you with greater details about those good laws that passed. We had a really great year. And we are an extremely strong team, and we work together to pass these bills, such as, like I indicated, the ghost gun ban, the Climate Solutions Act, the Time to Care Act, the Abortion Care Access Act, the Retirement Tax Elimination Act of 2022, which was a big deal, the Family Budget Boosters, and many other laws to help us recover and rebuild from the pandemic and, of course, propel all Marylanders forward. I just want to begin by, before I turn it over to Delegate Kelly, I wanted to highlight some laws that I and my colleagues passed to uplift women, children, and families and seniors in vulnerable communities, and to protect public safety at the same time and fight domestic violence and fight things like child neglect and abuse, and strengthen our cybersecurity capabilities in cannabis. As you know, you heard about the legislature finally passing the ban on ghost guns, along with Attorney General Brian Frosh and my partner on the House side, Delegate Leslie Lopez, and all of the delegates here. I led efforts to pass a law to ban what they call unserialized ghost guns in Maryland. They're very easy to assemble and just require a few screws and a drill. And once you have that, you can transform it into a very functional firearm. And they lack serial numbers and they require absolutely no background checks. So they're untraceable, and they become the weapons of choice for violent criminals, domestic abusers, gangs, and recently terrorists and white supremacist groups. Alarmingly, children are also purchasing these firearms online. All they need is a credit card. And they're even more proficient at assembling them than the adults. They're more tech savvy. Ghost guns are showing up in our schools, unfortunately, in our playgrounds, and they're used to fatally shoot other kids or kill people. So this new law will enable our law enforcement and our state's attorneys to solve and prosecute more crimes to keep us and our families and our communities safe from the harm of these easily accessible and untraceable firearms. And I think, we didn't do this by ourselves. Our District 16 team didn't do it ourselves. We had to have you, the advocates, come either by Zoom and on the House side or in the Senate in person, help us advocate and pass these bills. It was a major endeavor. Delegate Lopez and I have been trying to get this thing through for 4 years, and thanks to all the advocates, we're able to do this. I'd like to give a shout out to Moms Demand Action, Everytown, Marylanders Against Gun Violence, Brady, and especially our partners, Jews United for Justice, and the Women's Democratic Club, and other leaders and advocates who joined us. Like I said, it's a partnership, it's a coalition building. We all did this together, and it actually passed with some bipartisan support. 3 Republicans in the Senate actually supported it. So that's progress indeed. The legislature also passed my bill, major change to our current hearsay rule to allow statements made by child abuse and neglect victims to like therapists, social workers, trained professionals in cases where they are the victims or they are witnesses to violent crimes or crimes of violence. Allowing those statements into evidence is very critical in protecting those children and domestic violence victims, while also being able to effectively prosecute crimes against them. That has been in the works for a couple of years. We've had enormous opposition, of course. Usually it's the defense bar, so that sort of thing. But we are so happy that it passed. And then building on the laws I have passed in the past to fight stalking, we passed a law to include and define electronic stalking, which is a new type of lethal and relentless stalking that often leads to murder, sexual assault, domestic violence, and also a law to require law enforcement to get training in electronic stalking so they can help identify this new form of vicious stalking, better assist victims and prosecutors. I want to tell you about a bill that I'm very disappointed did not get out of the Senate. This was a bill to ban marriage as a defense to sex crimes that was introduced by myself and Delegate Charlotte Crutchfield. We actually reached a consensus in a conference committee and it was about to pass, but on the last day of session, the last few minutes, it wasn't pulled up for a vote by the chamber and the time ran out, unfortunately. And I have another bill that I and Delegate Brooke Lehrman introduced to provide safe harbor to child sex trafficking victims. It also reached a consensus with the conference committee, but it was not pulled up on the last day for a vote and time ran out. So we intend to bring that again next year. The train's coming down the tracks. We're never giving up. And the president of the Senate and the House Speaker, of course, they're all behind us on this. And I know the president of the Senate has told me it'll be the highest priority next session. We also passed several measures to confront the ever-present issue of housing insecurity and instability, enhanced, of course, by the pandemic, which includes providing $14 million to fund access to counsel in evictions, a special fund for those facing evictions. And of course, my bill to allow landlords to receive rental payments from local government entities, and a legislation to require judges to pause eviction when the tenant provides evidence that a rental assistance request is still pending and is on the way, and protecting tenants from unreasonable and arbitrary deductions unless there is contrary documented evidence presented, and other measures. The legislature also passed my and Delegate Karen Young's bill, which was called Self-Direction Act of 2022, to help ensure that qualified individuals with developmental disabilities receive quality self-directed care, enabling them to live with dignity and more independence. And I thank the advocates, some in our District 16 group here, that came down and helped us out on that. There was a disappointing move on one of my bills. My bill, the Maryland Online Consumer and Child Protection Act, which bans third parties from selling, sharing, or deleting or altering our sensitive personal information, did not move forward. But I'm bringing it again next year, and we're going to have even more strength behind it. The legislature also passed my bill to update what they call the Maryland Online hold on, that's the wrong one, MPIPA, the Maryland Personal Information Protection Act, to ensure that commercial entities effectively protect your personal data against theft and misuse, and timely respond and notify you all, consumers, when there's a breach, and other measures to protect consumers against harm associated with a terrible breach. And with respect to cybersecurity, to help our state and local governments prevent and protect against cyber attacks, we provided $570 million in the operating budget, and we passed measures to update our IT systems and centralize the authority of the Maryland Department of Information Technology and other related measures. And the legislature also passed my bill to protect the privacy and misuse of student data and information. With respect to cannabis reform and legalization, Marylanders will now have that opportunity to vote on a referendum to legalize adult use of cannabis. And of course, if the voters affirm at the polls, the legislature will finalize the licensing and taxation implementation measures and use a disparity study results to seek equitable market access and correct past criminalization disparities. And now I will turn it over to my wonderful colleague, the new HGO Vice Chair, Delegate Ariana Kelly. Thank you again for the privilege and honor of being able to serve and represent you in the Maryland State Senate.
Thank you, Susan. And that was such a wonderful recap. It was very thorough. So thank you for that. You made everybody else's job easier. I want to thank everyone for joining us today. I see a lot of friendly and familiar faces. I don't want to repeat myself if you've heard my usual spiels and jokes before. So I'll try and shake it up a little bit and keep it as fresh as possible. I'm really, really exhausted today. I'm wearing my blue dress with my red necklace, which you will see on TV every day for the last 2 weeks, because it looks good on TV and I just pick it up off my floor every day and put it on, because ever since that Roe v. Wade decision was leaked, I've been not sleeping very much and just working constantly, which is not a good thing. I think elected officials are always looking for press, right? But I'm not looking for it in this way. I'm very concerned about what is happening at the federal level. And I'm very, very thankful that we were able to pass the Abortion Care Access Act, which Senator Lee referenced earlier. So I'll talk about that in a minute, but I want to go through a couple of other buckets of work that I've also been doing. As Senator Lee mentioned, I'm on the Health and Government Operations Committee, and I was appointed vice chair under the new chairman, who is Jocelyn Pena-Melnick, who is a mentor and extraordinary and visionary and so good. And I'm so excited to work with our previous chair, Shane Pendergrass, also a mentor, very graciously allowed these appointments to happen before the end of her term, because she wanted to hand the committee off to folks that so it was a seamless transition. And that's what you're getting, which is great, because healthcare is just so important. The issues that we deal with on HGO are critical, especially now during the pandemic, as hopefully we exit the pandemic here. There's a seamless leadership transition there, but just want to shout out to my always chairman, my forever chairman, Shane Pendergrass, my new chairman, Jocelyn Pena-Melnick, who is a dream to be working with, and let you know a little bit about sort of the healthcare related issues that I have been working with that are not abortion related first. So I spent a lot of my focus this year in 2 other areas. In addition to paid family leave and abortion access, I wanted to work on issues related to seniors, and I wanted to work on issues related to our healthcare workforce. The healthcare workforce obviously has been under tremendous strain the last couple of years, and I do chair the health occupations and the long-term care subcommittee. So long-term care, we deal with a lot of seniors issues, and health occupations is obviously the healthcare workforce. So let me talk first about work we did for seniors. We made a lot of progress this year, which is great. Delegate Corman, when it's his turn to talk, will tell you how we got all this money. I don't know, but we had money. It was amazing. I'm joking. I probably could make up an answer, but he would give you a much better answer. But for the first time in my 12 years on the committee, we were able to accomplish those big bucket wish list items for healthcare. So you will see, if you haven't learned already, that we finally passed coverage for dental services in Medicaid for adults. This is huge. Maryland was way behind, and we should have been doing that for ages, but it's amazing that we were able to do that. That was a big ticket item. The other big ticket item that had been on my personal to-do list for so long and has been a priority for so many of my colleagues long before I came here 12 years ago was the home and community-based services waiver, which is a Medicaid waiver program, which particularly helps seniors who want to age in place and receive Medicaid services at home or in the community. Maryland, in my opinion, is very biased towards institutionalized care in their Medicaid program. It's a deep institutional bias that we've been trying to shake. I hear from residents in District 16 all the time about how they would much prefer to age in place. Polling shows 90% of seniors want to age in place. Other states are lapping us on this, and it has been humiliating, embarrassing. I'm mortified at the level of services we provide to seniors who choose to age in place in Maryland as opposed to in nursing care. So that being said, we had this huge wait list on the home and community-based services waiver. We were humiliated in the Washington Post, as we deserved to be, talking about this 8-year wait list, which is ridiculous. The Department of Health really had no intention of filling vacant waiver slots. We did finally pass legislation that's going to force them to fill vacant waiver slots and reduce the length of the wait list and expand the waiver. So that is huge. It's also a project we're going to need to babysit very closely because, as I mentioned, there's this real institutional bias, basically premised on the idea that, if you can keep people out of Medicaid by forcing Medicaid to be only delivered in institutionalized care, the state will save money. Which is true, but where's the money coming from, right? Families are becoming, are draining not only their own resources, but the resources of their family and their loved ones, their children and their grandchildren. It's immoral. So that's the tension. Do we support our seniors or not? Do we believe in care and long-term care services for poor seniors? I do. So I'm really excited about the progress we're making. I passed 2 pieces of legislation related to aging. One, and a lot of how we talk about aging policy has to do with sort of on a wealth scale, right? We have this public program, Medicaid, for those with no wealth. And then we have very expensive programs that people with lots of wealth can participate in. And the folks in the middle kind of fall through the cracks a lot of the time. Improving the programs for low-income people is huge. Improving the opportunities for folks with wealth is huge, but really figuring out how to target that middle is also really important. So one of the things we did was we passed a continuing care at home piece of legislation. So those of you who are familiar with the CCRC model of care, this is more on the high end. All 4 of my grandparents were at Riderwood, which is a CCRC. You can go from independent living to assisted living to nursing care all in the same site. It's very convenient, especially for people who are partnered and want to age with their partner. It's a wonderful model. It's also costs hundreds of thousands of dollars to buy into. The continuing care at home model is more affordable than that, and it allows folks to be at home, but participating in the CCRC model. So when that time comes, first of all, for water aerobics, which is my dream. I dream about this all the time, retirement years when I can do water aerobics at Riderwood or its equivalent, or other community type programs, you can participate in that. But also, as you transition into assisted living services, those could come to your home. And when it's time for nursing care, you would be eligible to use the nursing unit at the CCRC. So it's a model that works well in other states. Maryland had prohibited it for ridiculous regulatory reasons. So we changed that, and we're going to allow that model in Maryland. I'm hoping it will grow. I think there's a huge demand for that type of care. So that's going to help more of our middle and upper middle income residents, but it's a great model. I'm very excited to have it. The other thing I did is for folks who are on the lower end of the wealth spectrum, folks who are long-term care Medicaid eligible. I did with Senator Feldman a pilot program in partnership with Howard and Montgomery counties that's going to really look at how we can deliver what's called adult daycare services to the Medicaid eligible population. In Montgomery County, we particularly have adult daycares that target different ethnic and immigrant communities, which are really extraordinary. And these adult daycare services can, someone can come pick you up, take you to the program during the day, provide care that way, and integrate medical care. One of the things that we learned through the COVID pandemic is that People aren't always comfortable going to these facilities right now, particularly as they're older. This pilot program is going to really explore how we can integrate Medicaid and Medicare services, but largely long-term care Medicaid services with adult daycare and at-home services and medical monitoring and things like that. So that'll be cool. And I'm really interested to see the results of that study because it's a pilot and we're hoping we can make it a statewide program if it proves effective at delivering services and saving money. The best thing about that pilot is that a company that provides these services is paying for all of it. So no cost to us to figure out if it works or not. We did a lot of work with assisted living. Assisted livings in Maryland have been less stringently regulated than nursing care for a long time. This has been a growing problem. So we passed a couple of major pieces of legislation related to licensing assisted living managers. Assisted living managers for larger facilities had already been licensed through regulation, but those for the smaller facilities were not licensed at all. Again, this is a huge problem for lower income populations. Some of these assisted livings just, take the Social Security check straight away, and there wasn't a ton of oversight. So we were also doing a study on the quality of care at some of these at any of these smaller assisted livings, 9 and fewer beds. So we're going to know a lot more about how to effectively support residents who are using assisted living in the state of Maryland. And this is a really good thing. Both of these bills were major priorities for Chairman Dolores Kelly, who was the finance chairman from Baltimore County, who retired this year after, multiple decades long stellar career, advancing numerous wonderful priorities, but she also has a real special place in her heart for seniors. So I'm glad we were able to pass those bills. In terms of the workforce, I don't want to go on forever. I was going to talk for 5 minutes. I have so much to say, you guys. We had a big session. I'll quickly go through the workforce bills. We wanted to make significant investments in our healthcare workforce. Number one, because it was the right thing to do, because these are our heroes who helped us get through the pandemic. Number two, because our hospitals and our long-term care facilities were screaming at us, oh my God, I cannot get anyone to take a job. We have 30% vacancy rates. It's unbelievable. I don't know what to do. You have to do something. Both of those things are happening at the same time in Maryland. So we passed a number of pieces of legislation. One of them, which I really love, is an SEIU bill that develops career ladders for healthcare professionals. So it's a matching grant program basically to help elevate people within the healthcare field, which is wonderful. So they will be getting free training, likely at community colleges or HBCUs, paid for by their employer to move up in their healthcare careers, which is great. We passed a nursing loan repayment program for nurses who have student loans. We have already had one in place for physicians for many years. I don't know if you guys have heard me talk before, but a lot of times we forget to give women the money. So this is my Give Women the Money This Year bill, right? So the nurses loan repayment program is up and running, which is wonderful. I passed a piece of legislation with Senator Pam Beidel, which is a workforce commission. It's an emergency piece of legislation. I'm meeting with Secretary Schrader tomorrow to talk more about how we're going to get this moving. But basically, we're going to have an interim report at the end of this year, and then another report at the end of next year. And we're going to look sort of full circle at where our workforce needs are and what investments we need to make to ensure that we are able to effectively staff our hospitals, our long-term care facilities, and our network of clinics and public health facilities and schools across the state. There's a lot of work to be done in that space. So I'm excited. We're bringing together, it's one of these bills where we tell all the agencies they really have to start talking to each other because they haven't been effectively at all. And we're really hoping to work with industry and the agencies to figure out some big picture solutions. And then in addition to that, I also had a low-hanging fruit bill that dealt specifically with the nursing workforce. You may have seen some commercials on the television complaining about long lines at the Board of Nursing for license renewals and things like that. It got some national press too. Our Board of Nursing has been swamped, overwhelmed. The cyber attack did not help that. Their computer systems were down for a couple of months. That has a real life impact on our ability to deliver healthcare. So we have been working very closely with the Board of Nursing to make sure that they are, doing basic things like, huge shortage of certified nursing assistants, making sure we're issuing licenses in an expedient manner for those folks, making sure that we have the tests taking place in a regular regular intervals so that people who are qualified to take the test can take the test so they can get the license. Administrative things like that that had been really clogged up. And then there was a preceptor tax credit in that bill. So one of the things we also, again, had found in medical, in the doctor space, but hadn't yet implemented in the nurses space is, it takes time and energy for people to train nurses on the job as preceptors. So now we have a tax credit for those folks who are doing that preceptoring. So all of this investment in the nursing workforce, hugely the right thing to do, but also, notably falls into that space of women's economic empowerment, right? It's interesting that we have all these programs that we have always had for doctors, but we never put in place for nurses. And it took the COVID pandemic for us to wake up and be like, holy cow, we are completely dependent on women in the workforce, and we have to keep them working, and we have to show them our appreciation, and not just our appreciation, but equitable compensation and things like that, which does bring me into the last two bills I wanted to talk about, the Paid Family and Medical Leave Bill and the Abortion Care Access Act. So on paid family and medical leave, which is called the Time to Care bill, and I see a lot of advocates for that bill here in the audience today, so I don't need to talk too much. Really, really glad we passed that bill. It is going to provide 12 weeks of paid family and medical leave for the workforce in the state of Maryland. You guys have been here every year, so you've probably heard me talking about this every year for many, many years, but I want to give a shout out to my dear friend, Delegate Chris Valderrama, who's from Prince George's County, and Senator Antonio Hayes, who's from Baltimore City. They carried this really important bill across the finish line this year, but also definitely want a strong shout out to my colleague, Mark Corman, who I'm about to pass this off to. When Delegate Corman, as chair of the Montgomery County delegation, had to identify priorities that were consistent with Montgomery County values, he came up with this one, which I think really made a huge difference in the ability of this bill to succeed this year. So, for folks in the healthcare workforce, for folks in retail, for folks in professional world, across the spectrum, this is going to help people both be with their families at times that they need it, but also stay in the workforce, which is what the economy needs, right? It helps us balance needs, and I'm so excited about it. Delaware just passed it, I think, today. So, we're seeing more and more states do this. I think we were maybe 14. I'm not sure, maybe 13. Anyway, very excited about that. And really good for seniors. I was just talking to a long-term care industry group. They were all pissed off that we passed this bill because they're worried because their workforce is all female, and what if they have to give them maternity leave? And I'm trying to explain, if they're pregnant and they have the baby, you have to do something, right? You can't just ignore it. Also, they're not going to fake it. So let's think about this a little differently. And that is sort of segues really nicely into the Abortion Care Access Act, which I've been talking to Republicans about for the last couple of days. And I just, I would like everyone here to think a little bit about what overturning Roe v. Wade is going to mean for our business community. If you are basically requiring forced birth for women who would otherwise choose not to continue their pregnancies, not only is there a huge human rights problem there, which is what I have largely concerned myself with, but from the Republican perspective, there's a business problem there too. Big, big business problem. We're not talking about that because this issue has become so highly politicized. And that's something people have been talking to me about over the last couple of weeks. How do we get to a place where we effectively don't have any pro-choice Republicans in the state of Maryland anymore? When we went in for that vote, we had one delegate who had run as pro-choice as a Republican. They did not vote for this bill. We had one senator who had run as pro-choice as a Republican. He did not vote for this bill. As we saw, Governor Hogan, who has been neutral, he's in the settled law bucket of Maryland Republicans, vetoed the bill and is now not funding the clinical training part of the bill. So it's very polarized and it's unfortunate. I will just briefly tell you what the bill does. Basically, we saw this decision coming, and we wanted to make sure we were addressing both the provider shortage, which is real in Maryland already. Even before Roe v. Wade is overturned, we have 2 out of 3 counties in Maryland have no abortion provider. That's huge. That's meaningful. And that's a significant decrease since we codified Roe versus Wade 30 years ago. So shortage of abortion providers. And we also have these financial barriers to care, right? We have modernized how healthcare is delivered over the last 30 years, but we haven't ever addressed how abortion care is funded. So we wanted to make sure insurance was required to cover this care with no cost sharing, same way we have preventative services covered, no cost sharing, no deductible, easier access to care, make sure that people who are on Medicaid are treated equitably. They are not different. They don't have fewer rights just because they are low income, profoundly important. And establish this clinical training program. We're allowing nurse practitioners, physician assistants, nurse midwives to provide abortion care, just like they provide labor and delivery, miscarriage management, and contraceptive services. A lot more complicated things than abortion. They're already doing as primary care and reproductive health care providers in Maryland. Take away the political restriction that prevents them from providing abortion care. And in doing so, that's that $3.5 million that you've been hearing about in the news. We created the first in the nation clinical training fund. The last thing I will make sure everybody who's listening knows is that when this decision is finalized and 26 states either ban or severely restrict abortion access, 44% of OBGYNs are going to be trained in states where they cannot get abortion training. So there is a huge void to be filled. And Maryland was the first in the nation state to address that with this fund. I'm really, really proud that we developed this fund. And I am hopeful that we'll get some funding released for it this year, but we will definitely get it funded next year because it was mandated in the bill. With that, I will pass it off to our colleague who is in charge of all the money, Delegate Corman.
Thank you, Ariana. I just want to give a huge shout out. Obviously, she worked on a lot of the key issues this year. I think it was the day we did the veto overrides and we overrode the veto of the abortion access bill and the parental leave bill that I walked back to her desk and asked if it was the greatest day of her, legislative career, basically the equivalent of me getting WMATA funded and the Orioles winning a playoff game on the same day. And she just gave me a little smile. She was obviously very happy. And that was a few days before she was named vice chair of one of our 6 standing committees. So obviously an outstanding session for Delegate Kelly, and Senator Lee always has an outstanding session, is always productive. But on the ghost gun bill in particular, that was a huge multi-year lift and a great success for Maryland. And also a shout out to the senator. She was honored earlier this week by the AAPI Democrats for her, not only her legislative successes, but also really being sort of a beacon to many people from diverse communities who are coming up in politics. So congratulations, Senator Lee. I want to talk about a few things. I mean, first, I just want to give sort of the overall picture of where we are as a state and a legislative body, which is this is not the stodgy old Maryland General Assembly that, frankly, at least 3/4 of us ran for. And obviously, that's really shown by the fact that the majority whip in the Senate is Susan Lee and the vice chair of one of our 6 standing committees is Ariana Kelly. I guess the way I would put it is mainstream progressive Democrats are in charge of the General Assembly now at multiple levels of leadership and doing big things. Senator Lee really touched on a lot of these topics, but I'll just say again, the cannabis that'll be on the ballot this November, paid parental leave, the Climate Solutions Act, I know Delegate Love will talk more about, Medicaid, dental, ghost guns. It used to be the case that maybe one of those, perhaps 2, could have been done in a 90-day legislative session. And we passed plenty of other important bills, but not things that are such tentpole pieces of legislation. And this year we did them all. And last year was similar, frankly. We had a similar story to tell last year. So things are really progressing in terms of the overall story of how political progress is made here in Maryland. And I'm really thankful to all of you for letting me be a part of that. In addition to being obviously your representative in Annapolis, which is my most important job, I have a couple of other titles that I'll talk a little about the work I do with those. One is chair of the Appropriations Subcommittee on Transportation and the Environment. And one, as Delegate Kelly said, is chair of the 24-member Montgomery County House delegation. On the appropriations side, I don't know if I'm in charge of the money, like Delegate Kelly said, but I certainly spend a lot of time working on the budget and thinking about it, in particular, the agencies that are in sort of the transportation and environment bucket. So the Maryland Department of Transportation, the Maryland Department of the Environment, the Public Service Commission that regulates our utilities, the Maryland Department of Agriculture, the Maryland the Maryland Energy Administration, issues like that. And, that in addition to the budget also presents an opportunity to work on some major pieces of legislation in those issue areas. For example, this year we successfully shepherded through a bipartisan commuter rail bill that will include over time improving infrastructure and service on the Brunswick line, which is the MARC train, the really well-named MARC train line that runs through Montgomery County, frankly, along a lot of the same corridor as 270, which I know is an interest for a lot of people. And we passed a bill this year on a bipartisan basis to bring some improvement to that. We also, obviously, as Delegate Kelly said, had the opportunity to bring home a lot of money. And a lot of it was focused on infrastructure. I'll focus on our area. We brought back $2.5 million for a park around the Women's Cooperative Farm Market in downtown Bethesda, $12 million for the Bethesda South entrance that'll connect to the Purple Line. And I'm sure there are questions about the Purple Line that I'm happy to talk about in the Q&A. $1.25 million for a chronic flooding project that a lot of you have actually emailed me about over the years. There's flooding at the Metropolitan Building in downtown Bethesda, which is over the Chipotle. That's what most of us think of it as. And it's also over a county garage. And that flooding has led to continuous shorting out of the elevator there. And I get a lot of emails that say, you know, why can't they fix this elevator? And it's because of the flooding problem. And we secured the funding to deal with the underlying flooding problem that will then allow us to go ahead and fix the elevator. $130,000 for the Glen Echo Park parking lot, so you can get your kids and grandkids to the carousel in a smooth parking lot. $8.8 million for the county's transition to zero emission buses. $10 million for pedestrian and other infrastructure improvements around the White Flint area, or North Bethesda, as we're now trying to call it. I grew up here, so it'll always be White Flint to me, but they're working on rebranding, as well as a down payment on a new White Flint metro entrance, and almost $65 million for the county's countywide bus rapid transit program. And I'll just mention, since Peggy asked about it in the comments, that, you know, obviously that needs to work in concert with the regional bus program. And our transportation network on the transit side is a little complicated by the fact that there are so many overlapping jurisdictions. We're not a single city plopped in a single state. We really work on a regional basis with, you know, our partners in Prince George's County, obviously our partners in Washington, D.C., our partners in Virginia, including lots of different counties and municipalities in Virginia that make doing things like streamlining our bus network very complicated and difficult to do. And it's also made the management of our metro system, which I'm a strong supporter of, you know, needlessly complicated. Because we're in a situation, I've said this before for those of you who have heard my spiel, that when everybody's in charge, as is the case with our metro system, no one's in charge. And I think we're seeing that. Maryland has really stepped up over the past few years to increase its funding and commitment to the metro system. And obviously some of what's happened to Metro is beyond its control, the pandemic. That's not something that, you know, Metro itself is in charge of. And some things like having to remove all the beautiful rail cars that were purchased over the past 5 years from service because of a safety issue, well, that is within Metro's control and is something that stronger governance could have potentially done something about. So obviously more to come on that. On the budget and all those great programs from Montgomery County and projects, obviously it was in the broader context of a good budget year. I think there were two reasons that the budget was better than anybody expected. One is the underlying strength of Maryland. We're just really lucky to have a diverse, successful, highly educated workforce that frankly during the past 2+ years could do a lot of their work from Zoom. Not everybody, obviously we have many people who did not experience the pandemic the way maybe a lot of us on this call did. But for a large portion of our workforce, we were very lucky. But also it was the federal government stepping up in a huge way. And I'll say, as a Democrat, I think that's really important. And I hope we don't forget that lesson, that the reason the economy did not go into a Great Recession or even a Great Depression style shock was because the federal government stepped up as quickly and as massively as it did. And that doesn't mean there aren't after effects of that maybe we prefer not to have. And I know we're living through some of them. But it's also better than, you know, double-digit or higher, unemployment, you know, in the 10, 11% or higher range. Now, again, obviously not everyone experienced the pandemic in a way that was, as stable, either their health or their economics. But overall, Maryland has been plugging through in the aggregate in a pretty strong way. And that allowed us to put about 10% of our state budget into the rainy day fund, which is higher than we've been able to do in the past few years. Set aside $350 million for tax changes that we really targeted towards the most at need seniors, and I can talk more about that if people are interested. Chipping away at some of the wait lists that we have for various programs like the autism waiver and other wait lists we have under various Medicaid and other programs. We also set aside $800 million for future year K through 12 public education cost, even while spending $8 billion this year, including about $900 million from Montgomery County public schools. Setting aside that $800 million is really important because it seems like ancient history now, but for a number of years, the big debate that a lot of us had in Annapolis was how to pay for public education. And right now we're in a position where we have the resources to do that and try to, get our schools where they need to be. Not only, because of learning loss and the effects of COVID and the difficulties there, although those were significant, but many of our schools before COVID were not where they needed to be. And so we're in a position financially right now to try to claw back and then up from there. And we're committed to doing that. And of course, all that dovetails with my work as chair of the Montgomery County delegation. Many of those statewide priorities like paid parental leave were the priorities of our 24-member Montgomery County House delegation. We also worked to make sure that we had business impact grants for some of the businesses affected by the Purple Line construction in particular, that we were able to access our school construction money now that the students are back in school. I'm hearing more from parents again about school crowding, maybe less crowded than when they were doing school on Zoom and at the kitchen table, but pretty crowded in some of our schools, and all sorts of other really important priorities for the county. I'll just say personally, one of the bills I'm most proud of that I was the sponsor of is the Young Readers Program Expansion Act, something I first learned about actually from some constituents, Susan Greif and her husband Peter in particular, who are the leads of our county's Imagination Library, which is a partnership program with Dolly Parton, $5 to my first colleague that belts out in 9 to 5. This is a program that sends a book a month to children under 5 to try to encourage literacy and more reading at home and to understand the importance of books. The thing behind me is not a digital backdrop. That's my actual wall at home. And so I think reading is really important. We modeled the program after a program we did for summer snaps, what we used to call food stamps for students who usually get their food through the school system. It's a county and state matching program. The summer SNAP program started at a few $100,000 and now has expanded to several $1 million and benefits lots of kids, especially in Montgomery County, one of the first beneficiaries of that program. This follows a similar model of encouraging the counties to work with the state to expand Imagination Library type programs, sending a book a month to young people whose parents opt in to not just feed their bellies, but to feed their brains and their souls as well. So I'm very proud of that bill. It's sitting on the governor's desk awaiting his signature. With that, let me turn it over to my colleague, Delegate Love. About halfway through our legislative session, the Baltimore Sun ran a story about how much environmental legislation the General Assembly was working on this year. They highlighted 4 bills in that story. 3 of those bills were sponsored by Delegate Love. That's a pretty high rate of coverage, especially from a publication that doesn't really serve Montgomery County. And it just shows how important the work she's doing on the environment and a lot of other issues that she will tell you about now. So let me turn it over to Delegate Love.
Thank you, Delegate Corman. And I'm sitting here wrestling. Do I start singing or do I not? I really want that $5. So, Delegate Kelly, Senator Lee, you going to jump in with me? Working 9 to 5.
What? Come on. Wait,
Sarah's getting the 5.
All right.
Mark's in charge of the money. Sarah gets it. Okay.
There you go. So hello, everyone. Thank you so much for being here tonight. It is so wonderful to see so many of you, so many friends. As you've heard, it was an incredible session. I mean, I thought at the end of last session that I would never see such an incredibly productive session. I was just blown away with what we did last session. And then this session happens and it was even more amazing. So you, thank you, Stephen, appreciate that. Sorry, comment in the chat about this being recorded. So my bad singing voice is out there for posterity. But at any rate, it really was an incredible session. Being on the Environment and Transportation Committee, I was able to have a hand in a lot of the really exciting environmental bills. As Delegate Corman mentioned, I was really excited when the Baltimore Sun highlighted 3 of my bills, and then the 4th one was the Climate Solutions Act, which I will talk about as well. The 3 that the Sun highlighted, the first one is what I call the zombie permit bill. What we saw over the 8 years of the Hogan administration is what Republicans say they will do, which is reduce the size of government. And they did in department across department, and especially in the Department of the Environment and in their water quality program. And what resulted from that decimating of their workforce is that water quality permits were being extended. So think about water treatment plants, these big chicken rendering plants. There were the backwater or Patapsco and backwater water treatment plants in Baltimore. I mean, it was across Dorchester, all across the state. We saw time and time again where the Maryland Department of the Environment had extended water discharge permits without investigating, without doing what they were supposed to do. So in fact, these entities were spewing pollution into our waterways. In St. Mary's County, an entity was spewing pollution into the waterway. And it wasn't until the Virginia press started talking about people getting sick from the oysters that the Maryland Department of Environment was like, oh yeah, our bad. We heard about that 2 weeks ago and we didn't do anything about it. So I had a bill with Senator Pinsky that really tightened what the Maryland Department of Environment has to do with these zombie permits that have expired but keep going. And it requires them to up their workforce and to, we created benchmarks. So rather than reacting on the back end and having to go through lawsuits and spend all that money, they actually have to inspect and levy fines, which they haven't been doing, so that entities will know that they are violating the permit. Another one is called the Conservation Finance Act, and I cross-filed this with Senator Sarah Elfreth, and this is a new, exciting kind of nationwide model that incentivizes private financing to help us meet our environmental goals. And I serve on the Chesapeake Bay Commission, which is a tri-state legislative body. And legislators from Pennsylvania and Virginia were very interested in this idea. And it's very helpful for us to incentivize this private financing to help us meet our water quality goals. The other one that I'm amazed got through and really excited about, as Senator Lee mentioned, has to do with PFAS, per and polyfluoroalkyl substances, which are a class of chemicals that are toxic. And we started to learn about it in the 60s, really, with Teflon and the problems that were happening at DuPont in West Virginia. And if any of you have seen the documentary Dark Waters with Mark Ruffalo, it's pretty scary that DuPont knew how toxic these chemicals were and kept fighting it for decades and decades and decades. And we were able, with the leadership of now Chair Pena Melnick, to get this bill through. And what this bill does is it prohibits the use or sale of firefighting foam with intentionally added PFAS, food packaging, and rugs and carpets with intentionally added PFAS. So if you think about your microwave popcorn, my daughter loves microwave popcorn, so we've had to wean her off of that. But the reason the kernels slide off the bag is because they're coated with PFAS. If you think of a cardboard container that has food in it, takeout food, the reason the greasy food doesn't land in your lap is a layer of PFAS, quite frankly. And there are alternatives that are not toxic. And this was one of those really great experiences where the firefighting community and the environmental community came together to really push for this bill. And it passed unanimously in the Senate. I think we had 5 Republicans vote against it in a House, so huge bipartisan measure. At the bill signing, the governor declared it had been one of his priorities, which was great. Wish he had told us during session. But so that was another really exciting bill. The big one that got a lot of the press was the Climate Solutions Now Act. And I've got notes here because it was such a massive bill. So this bill requires Maryland to reduce greenhouse gases by 60% from 2006 levels by 2031, which is 20% greater than the requirements under current law. And we are to achieve net zero statewide greenhouse gas emissions by 2045. And that net zero is actually a really important statement, because that means we're not going to eliminate greenhouse gas emissions, but we're going to use other methods that get us to net zero, like trees. Trees are incredible. And I'll say something about trees a little bit later. So net zero greenhouse gas emissions by 2045. It's got a large environmental justice component. It requires the Maryland Department of the Environment to work with the Commission on Environmental Justice to really dig in and address issues of climate equity for communities that have been disproportionately affected by climate change. And importantly, it defines what it means to be an overburdened or underserved community. And that's going to be really important as we go forward and try to figure out how to address climate in these overburdened communities. There's also a really big piece on building energy performance standards. One of the biggest producers of carbon emissions are greenhouse gas emissions are buildings. So the bill, we had wanted to have mandates in the bill originally, but that got amended out through negotiations between Environment and Transportation, the Economic Matters Committee, and the Senate. So what the bill does now is it requires the Maryland Department of Environment to develop building energy performance standards to achieve a 20% reduction in net direct greenhouse gas emissions by 2030 and net zero by 2040. And it applies to state, commercial, or multifamily residential buildings with at least 35,000 square feet. So we're talking the really big buildings. And then there's going to be a task force that's going to work to make recommendations for programs and incentives to reduce emissions in the building sector through retrofitting and electrification. Lots of other things, but the only other thing I want to highlight from that bill is that it's got a pilot program for electric school buses, which is something some of our colleagues have been working on a lot. And then it requires 100% of the passenger car state vehicle fleet to be zero emission vehicles by 2031 and other light duty vehicles to be ZEVs by 2036. So really big bill, really exciting that we are taking such a huge leap forward on addressing climate change. Just want to touch on a couple of other things that we did in my committee, the Environment and Transportation Committee. We created a, we've passed a bill that will have the Maryland Department of Transportation create a blue sleeve that individuals can put their license in if they choose, that will identify that they've got some type of behavioral challenge or mental health challenge, or they might be on the spectrum. And the sleeve will note on the back what it is. So when someone is stopped by law enforcement and they pull out their license, it will go with that sleeve. So immediately the law enforcement officer knows, okay, if this person reacts a little differently than I'm expecting, this is why. And we heard a number of really heartbreaking stories about interactions with law enforcement and how helpful this can be to both the individual and to law enforcement. So we're really excited about that bill. It was also a really big bill for animals. After many, many years, we passed a bill to protect animals in extreme weather. So they have to have adequate shelter, shade, or some other shelter from the elements when it's too hot or too cold. And there are a bunch of definitions in the bill. So that was a big deal. I also was the sponsor of a wildlife trafficking bill that will prohibit the trafficking in Maryland of parts of 11 different imperiled species. And that was a really neat bill because it was also a bipartisan bill. And I learned a lot about, there's a huge problem with ivory trafficking in Maryland that I hadn't realized that this bill will really crack down on. And then very quickly, I just want to lift up again some of the amazing work of my colleagues. Senator Lee didn't mention two bills that she worked on in her committee that are really important, we raised the age of marriage in Maryland. It used to be 15, it's now 17. And that was a tough lift in her committee. And then we also passed a bill that when I don't want to use the term juvenile, but when a youth is in custody or being taken in custody by law enforcement, their parent or guardian has to be notified. And the judiciary has to create Miranda rights that kids can understand. And that's a huge, important step for protecting our children, because law enforcement can lie, and they do. And our kids get caught up, especially kids of color, get caught up in the criminal legal system. And then last but not least, along with Delegate Kelly, I've been working a lot on what we are going to do moving forward after the leaked draft. And so I have been talking to national legal experts. Delegate Kelly and I have been talking to pro-choice legislators around the country to try to look at a short-term and long-term goal. What are we going to do in an expanded access state? And we are that, thanks to Delegate Kelly. What's our next step? And how can states learn from us? How can we learn from other states to ensure that access to reproductive health care is safe here in Maryland? And again, I just want to thank you all for everything that you do to support us. This is a great team. You can hear all the diverse knowledge and experience, and I just love my team. So thank you.
Thank you, Sarah. Thank you, Delegate Love. You had a terrific session, and we all did, and we all worked together. I just wanted to give a shout out to some of the people in the audience. We have Delegate Bill Frick. Are you still there, Bill? We miss you. And as you know, the Montgomery County's Democratic Central Committee has on the ballot this year our wonderful Michael Tardif and Teresa Warman. So just remember that when you go to the polls. Also, we are joined also by a school board candidate, Julie Yang. Are you still here, Julie? Just give a shout out. And our wonderful Montgomery County State's Attorney, John McCarthy, is here, as well as our wonderful Clerk of the Court, Karen Bushnell. And not to forget David Naiman from the Board of Elections. He's here too. And a wonderful legend and wonderful Democrat, former chair of the Maryland Democratic Party, Susie Turnbull, was in the audience too. I give a shout out to her. And we have a candidate for County Council, Lori Ann Sells. Are you still here, Lori? Give a shout out to everybody. Anyway. Well, thank you everyone for joining us today. And I saw that Carol Stern has like 3 questions. Carol's always on top of everything. It's so delightful to see her. Despite the pandemic, she still came down to Annapolis to advocate on several different bills that actually passed, including my ghost guns bill, the abortion access care, the environmental bill, everything. She was there. Carol, thank you so much for your leadership and advocacy. We're just so grateful because you make our lives easier, and you highlight and you literally educate some of our colleagues that may not be on top of things like they should be. I see some other Jews United for Justice advocates in there too. Thank you so much. I think I saw Joe there. I saw a number of the people. I know I'm going to forget someone, and I saw Dr. Rockhour there and everybody else. But anyway, before I get off course here, because I know that you have a lot of questions, Carol, did you have one about the hybrid session? And you also wanted to ask Delegate Love about the departure of Maryland Department of Environment Secretary Ben Grubbles. Well, his departure, how will it affect the goals and legislative priorities implementation? And which one did you want us to take first?
Actually, it wasn't me who asked about the departure, but certainly the hybrid sessions are crucial. And I know that I'm hoping the House, which has already been doing it, will continue. But if you think about all the people who can't get to Annapolis who have been testifying, it's huge. The public access to the legislature is so vital. I mean, you know, we were very fortunate. We can get in the car. Many of us are retired. We go down there. But most of the people who can't testify can't get to Annapolis unless you keep it hybrid. And I don't know what we need to do to advocate. I know we have been trying, but your thoughts?
Yeah, I absolutely agree with you. You know, we got used to doing hearings via Zoom, and it allowed witnesses that normally could not come even before the pandemic to be able to testify on very complex issues. And the House side continued to have those online hearings, which were very beneficial because you didn't want to go down there and catch COVID or expose your kids to COVID because you were down there and you caught it. And also it allows witnesses that are across the country to be able to testify, as I said, on very complex issues. And the Senate for a little while was doing online hearings, and then it stopped at a certain point. But fortunately, I got to have witnesses like in California testify on that stalking bill before they decided to go in person again. But we heard from our constituents, they like to have this online hearings as long as we vote in person, because it allows more of a democracy, to have more participation in the political process. So I had asked and advocated for going back to these online hearings with our leadership, but they said we had to do it this way, but they may reconsider that again. So if you can help us out and advocate for this, that would be helpful. I wouldn't mind doing that. I wouldn't mind having hearings online again. We're still in the pandemic and we're still not at the finish line. So colleagues, did you want to add on anything else?
I mean, I'll just say, it's not just the online or hybrid committee hearings, which are really helpful. I mean, we had a local delegation bill hearing on ranked choice voting where we had an expert from, I think, New Mexico or Arizona, an election clerk who was able to zoom in, who we never would have had the benefit of their knowledge if we were doing in person. I mean, maybe they would have sent something in writing that very few of us, certainly everybody on this call, but very few others would have read. But there are other things also. I mean, it's hard to remember, but pre-COVID, we weren't video streaming all of the floor sessions. We were video streaming a select few of them, and they were all audio streamed, which was very hard to follow. We certainly don't want to lose that now that we're coming out of COVID. They didn't used to broadcast on streaming the committee voting sessions. The committee hearings were broadcast or streamed online, but not the voting sessions. So I would just say it's not just the hybrid access to committee hearings, although I agree that's important. There's other things that were positives of COVID that we want to hang on to. The Senate doesn't need to have phone booths around the senators' desks anymore. And we don't need to have a second House floor where we're all spaced out as we did last year, thankfully. But there are a lot of things we can hang on to in this new this new world. So keep advocating, Carol. A lot of us are advocating along with you.
Just one quick story, because I completely agree. I wasn't going to say anything, but Delegate Corman reminded me, and then Dr. Rockhour's comment reminded me again. You know, I had a bill this year for MedChi that dealt with something that an urgent care doctor found during the course of her practice, and it was just unconscionable, this prior authorization requirement we have for folks who have been sexually assaulted to get HIV prevention medication therapy. And she mentioned it to me in a constituent opportunity. I think we were all there at the MedChi meeting, and we wanted to do a bill to address this. And she needed to testify in order to explain what had happened so we could pass the bill, so we could help the sexual assault survivors. But she also runs an urgent care and she's crazy busy, right? But this year she was able to step away from her work day where she's helping people every minute of the day, step away, testify for 5 minutes instead of waiting for 8 hours, which was just not going to be feasible. And as a result of that, we were able to change the policy preventing the prior authorization, which is going to help sexual assault survivors. So huge policy implications for this. I agree.
Sarah, did you want to add on anything to that?
I just, I said no, and now I'm going to talk. I absolutely agree with what my colleagues have said. And I know the county council, I believe, is implementing doing hybrid hearings. So I'm really hoping that we can do that. And just a shout out to Delegate Corman, because the streaming and the access and the open government is something he is really focused on a lot. And so we are where we are because of a lot of his work.
Okay, Sarah, did you want to answer that question that they had about the departure of Secretary Grumbles about the impact?
Sure. Well,
on
as I
implementation?
noted in the chat, that I want to give a big shout out to the questioner. Gretchen Zekiel was an intern in my office, and she was amazing. And thank you, Gretchen, for everything that you did. You know, given that it's an election year, we were probably, and we will hopefully have a new administration. Well, we will have a new administration, hopefully a Democratic administration, and therefore new secretaries. You know what, it was the deputy secretary who is the new acting secretary, and I don't know him very well, so I don't know what he'll do differently, but things like the zombie permits, I mean, the governor let it become law over his signature. So they've got to do it. They have to staff. They are required to. So we'll see. And then the Maryland Department of Environment is also required to do a take back program of the PFAS around the state that various firefighters have. So they can't get out of that stuff. What else they will do? It's hard to say because I really don't know the deputy secretary very well at all.
Yeah, great. Thank you so much. I just wanted to, for us to just provide information to everyone out there who our staff is. My staff is in the chat right now and also participating. His name is, my chief of staff is named Michael Laurie. And I think he just sent you all my contact information. I also have a legislative director named Stacy Volodin, and also the communications person, Tracy Johnstone. Ariana, did you want to provide information on your contacts?
Sure. My chief of staff is actually also on here. Her name is Sharon Ringley, and she's also a District 16 resident. And she has worked tirelessly on all of our behalfs. So I know many of you have been in communication with her. I really want to thank her for everything she does.
I'll just go down the line. Joseph Swit, my aide, is on the call, the grandson of a District 16 resident.
And Selena Raleigh is my chief of staff. She could not make the call tonight, but she's amazing.
Thank you. You know, we're very accessible. If you have any questions whatsoever, if you have any concerns or issues, please do not ever hesitate to contact us, because we are here to serve you, and we're your public servants. So there are many issues that come up every so often. You know, even the minor. You know, if there's a tree in the highway or the grass isn't mowed, no issue is a small issue. We take it very seriously, and our staff is on top of things generally. But I'd like, is there any other questions? I know, Dr. Rockover, do you have a question about telehealth?
Yeah, I just want to say that telehealth, talking about being able to put testimony to you guys from our offices and whatever is really very valuable. But on our side, being able to have telehealth with our patients makes all the difference in the world. Of people who don't want to come into the office, you can go talk to people and do a lot of things. Can't do everything, but you can do a lot of things by telehealth and get a lot of things done, so the patients don't have to transport and get around with a lot of problems that they might have. And it's important that through the budget, both on the state side and federally, that the physicians are able to get paid for their services for that. It's really very important. I do want to thank Delegate Corman and Kelly, especially in terms of medical issues, in terms of getting 100% payment for what's called evaluation and management services in the Medicaid program. This is most valuable to get physicians into the program so that more patients can be seen. And that's really the problem, is that there aren't enough doctors in the Medicaid program because the payments are so small. But by bringing it up to at least Medicare levels, it induces more physicians to come in. And so that way patients don't have to drive from Washington County to Rockville to see their orthopedic surgeon, which is what has happened often enough in the past. The other thing that is important is the loan assistance repayment program that Delegate Kelly talked about. Although I do have to call her to task, there are female physicians that take advantage of that, and
We
male
love
nurses,
our female doctors. We love our male.
and male nurses. So
Yeah,
it's
but
not,
the nursing in Maryland is behind everywhere else. We're at like 85% female,
I-
but our
I'll-
doctors
I'll
are
agree with
catching up
you.
fast, as you
Absolutely.
know.
Okay, thank you.
Yeah, Dr. Rockower, thank you for coming down every year. You were even down here this year, and despite all the challenges of COVID, you still came down. We appreciate your advocacy, and Mackay's too, because some of us who are not on that particular committee that oversees it, like I'm on judicial proceedings, we're not always on top of all the 2,000 bills that come before us. And when you alert us about what's coming down the pipeline, what's a priority for doctors, that's very helpful for us, because particularly on the Senate, we want to help, shepherd it through. And if we're not on that committee, we could work on our colleagues on the respective committees. So thank you. And thank you for your work on telehealth. That has really changed things. That's changed the whole way that now you practice medicine too, because you can communicate with each other too. And that's been very important. I remember, I think I passed the first telehealth bill, and that was in the old days. And then Delegate Kelly built on it and really ran with it. And she's really done an excellent job, because in the beginning, there was a lot of opposition to want to reimburse physicians for doing telehealth. That was a big deal. And they just didn't want to do that. And they didn't even know what the technology was. They had no idea how it was going to help low-income communities, help people with disabilities who could not, they may have been in Western Maryland, but they wanted to go to Johns Hopkins in Baltimore and they could not. This has really been a game changer, and it has helped save lives and probably brought people together and improved medicine. So thank you, Dr. Rockower.
Well, thank you, and we appreciate your efforts.
Are there any other questions from our wonderful constituents out there? Just raise your, okay, Margaret, go ahead, you're on.
Unmute, please, Margaret.
Unmute yourself. Margaret Dennis, you are on.
Can you hear me?
Yes, there you go.
A very important environmental bill that didn't make it through this session was the chain of custody for artificial turf playing fields bill. Such a small step in the right direction and such an important environmental bill. Why did it not pass, and what can we do next session to make sure that it does?
Great question, Peggy. Thank you. Yes, a small step and a really, really important bill. I mean, talk about PFAS. It's in artificial turf. It made it out of the House. It's been a long time coming. And I'm not sure of the details of what happened in the Senate. I think it could have just gotten jammed up because of a lot of the other bills that were going through the Senate committee. I mean, climate solutions and conservation finance, et cetera, et cetera. So, it is coming back and we will keep trying.
Yeah, Margaret, I agree with Delegate Love. I think the priority this year was a Climate Change Solutions Act, and that took a lot of energy. And the respective Senate committee, EHE, that had jurisdiction over this bill was just totally overwhelmed with bills. In fact, usually it's judicial proceedings in the Senate and House Judiciary that has the most bills. But this time, Senate EHE committee, they had so much, they were staying there until the AM hours presiding over bills and hearings. And I just think it got caught up in the influx of so many bills and also the priority for the Climate Change Solutions Act. But I think I am hopeful that it will probably get through next year. So keep the great, excellent advocacy up and we will get it through.
Thank you.
Any other questions from our wonderful constituents? Okay. Wow, this is great. Oh, yes. Yeah. Geneva, go ahead. You are on.
Oh, sorry, I'm trying to adjust my setting. This is mostly maybe my not fully understanding all of the processes that go on with the passage of bills. But I was I've been trying to I've been going to my MGA endlessly trying to figure out whether the supported decision-making bill and the self-directed services bill, which both of which went to the governor, are actually going to become law. I mean, I know he can sign them or not sign them, and the MGA, my MGA tracker just says they've gone to the governor, and I can't figure out what's going on with them. Does anyone have any information?
Geneva, are you talking about the Self-Direction Act of 2022?
Correct. Yes.
Yeah, that's a bill that I introduced along with Delegate Karen Young. That's a very good bill, and thank goodness, thank you for your advocacy on that, because that's a major piece of legislation that basically codifies the self-direction program, which should have been done years ago, and keeps it makes everything transparent, and it creates more accountability, and it provides more quality. It'll ensure better quality service, independence, and dignity for those who use it. I thank the respective committees for getting it through, both in the House. Thank you, Delegate Kelly, and also on the Senate side. They really worked to get that out. And on the Senate side, it was the Senate Finance Committee, which I was really surprised. I thought it would go to EHE, but maybe it's good that it didn't, because it could have gotten caught up with all those other bills. So we haven't had any indication that when he's gonna, unless Michael is on. Michael, Lori, are you on the line? We have been monitoring what bills he's gonna sign, and we haven't seen that yet.
Geneva,
Delegate
Michael, just real quick, just to cut to this. First of all, Geneva, I think I passed you coming out of the metro yesterday. You were going in with Rob. But,
I'm sorry, I didn't see you.
I was in the mask. So
Okay.
the governor has 30 days after a bill is quote unquote presented to make a decision. There's a bill signing ceremony tomorrow, May 12th, and then 2 more coming up on May 16th and May 26th. And then, of course, bills that he doesn't sign, but he doesn't veto, will also just become law without his signature after that date. So it's actually the governor's website now, not the MGA website.
Okay.
You'll monitor, and there's a bill signing tab that has the bills.
Thanks.
Mark is correct, Geneva. You just have to monitor his website, because the last bill signing he didn't tell anybody, because there were some critical bills that I had on, and it's Delegate Love had on, but we somehow found out about it thanks to Delegate Corman, because he put it on the Facebook. Otherwise, we wouldn't have known that there was going to be a bill signing, and fortunately, we Delegate Love and I made it down there in time, but some people didn't get to. So we don't know right now, as of, what time is it? 8:20 p.m. We don't know if that self-direction bill is going to be signed or not, but as Mark said, you got 30 days after the bill passes. So it's whether or not he wants to sign. If he doesn't sign it, it's law. So
Yeah,
Yeah.
and my gut says we're not getting a veto on these bills. Right? These are good bills that help people.
They both passed
Yeah,
with overwhelming support, and I want to thank especially Senator Lee for her work sponsoring the Self-Directed Service Act in the Senate, and all of you for your support for both bills when they reach the House and Senate floors. They'll make a big difference in my son's life. And Mark, I'm so sorry that I didn't see you. We were rushing to the Nationals game, actually. So Robert was very excited. We hope we see you soon.
And I was rushing home for a kid's bedtime, so don't worry.
All right, thank you.
thank you, Geneva, too, for your leadership and advocacy on that bill too. Because when the advocates and the leaders came down on the Senate side and came in person, and despite all the challenges of COVID and the possibility of getting infected, it really made a difference, I think, because the chairman of the Finance Committee was very touched by this, and so were the other members. And I think that resulted in it finally passing. So thank you again.
Thank you. Rob was delighted to testify, and he had one of the best days of his life that day. So thank you very much.
Well, it's his victory too, I think. So are there any other questions that oh yes, Joe, Michael, could you unmute Joe? Can you unmute?
She's
Michael,
unmuted.
could you-
I'm
Okay,
unmuted.
you go, Joe.
I didn't know that PFAS were inside food containers. I just had takeout food the other day.
Joe, not all of them, not all of them. Okay, a lot of companies have moved away from PFAS. The market is moving in that direction. So, I wouldn't worry. You're okay.
Can we do something to make it not legal to use PFAS in food containers?
That's what my bill did. Yep.
Oh, so when will it start to take effect?
So 2024 is when we will transition out. So but like I said, a lot of companies are already moving away, McDonald's, Trader Joe's, Safeway, Chipotle, Sweet Greens. There's a huge long list of companies that have already recognized that this sort of food packaging with this toxic chemical is bad. So they're not doing it anymore already. So you're fine. You're okay.
Thank you, Sarah, for passing that bill too. It's it really is gonna make a big difference. Are there any other questions? Michael, do you see any other on the screen? Because I can't see everybody. Is there
I
anybody?
don't see any other questions unless somebody
Okay.
wants to raise their hand.
Well, the time has come to conclude our wonderful town hall. I'd like to thank all our wonderful constituents and even those who are not, but are still participating, and all the leaders and elected officials who have joined us tonight. We thank you for helping us, in the legislature, and it's a real honor and privilege to serve and represent you. And if you need anything, again, please don't hesitate to contact us or our staff. And thank you again for the honor and privilege of letting us represent you in the Maryland General Assembly.
Just inviting everyone to unmute and say goodnight.
I just want to add, I touched on this, but thank all the constituents for sending us this team, because we work so well together, and I feel so happy every day that this is the team I get to work with. So thank you for giving me a great team of colleagues.
Good night, everybody.
Thank
Stay
you,
safe and
everybody.
well.
Good
Stay safe and well.
Thank you.